There is something most seniors are never told clearly enough about vitamins. And by the time this is finished, you are going to look at the bottles in your medicine cabinet very differently. For decades, older adults have been encouraged to take vitamins as a daily habit. A pill for bones, a pill for energy, a pill for immunity. It sounds simple. It sounds responsible. But here's what almost nobody explains clearly. Some of the vitamins marketed specifically for seniors can, under certain conditions, make things worse. Not because vitamins are inherently dangerous, but because the aging body processes nutrients differently. The liver filters more slowly. The kidneys flush less efficiently. Nerves and blood vessels become more sensitive. What worked well at 40 may behave very differently at 65 or 75. At the same time, there are specific nutrients that research consistently connects to stronger bones, sharper memory, better heart function, and longer independent living. And most seniors are not getting enough of them. So today we are going to go through both sides. 4 vitamins that may cause problems after 60 depending on form or dose, and 4 that the research supports as genuinely important for aging adults. Let us start with the 4 that deserve more caution than they typically receive. The first is vitamin A in its retinol form. Vitamin A sounds like a straightforward health vitamin. It supports eye health, immunity, and skin. And in the right form and the right amount, it is beneficial. But the version found in many multivitamins and supplements, called retinol or retinol palmitate, is fat-soluble. That means it does not flush out through urine the way vitamin C or the B vitamins do. Instead, it accumulates in the liver and fatty tissues. After 60, that accumulation becomes more of a concern because the liver's processing efficiency declines with age. Excess retinol that would have been cleared more easily in younger years may now build up more steadily. Symptoms of excessive retinol intake can include dry skin, dizziness, joint discomfort, fatigue, and blurred vision, all of which are easy to dismiss as normal aging. Some research has also raised concerns about elevated vitamin A intake and cardiovascular risk in older adults. The safer alternative is beta-carotene, the form found naturally in sweet potatoes, carrots, spinach, and eggs. Your body converts beta-carotene into vitamin A only as needed. It is self-regulating, which means the risk of accumulation is much lower. If your supplement contains retinol or retinol palmitate and you are over 60, it is worth reviewing whether that form and dose are appropriate for your situation. The second vitamin to approach with more caution is iron supplementation. Iron is genuinely essential. But the reason most people need iron supplements is blood loss, whether from menstrual cycles, surgery, gastrointestinal issues, or a confirmed deficiency. After 60, most people are no longer losing iron the way they did when they were younger. Women have passed menopause. Men rarely have significant ongoing iron loss without an underlying medical reason. Iron is also not easily excreted. The body holds onto it. If you continue supplementing iron when you are not actually deficient, it can accumulate in organs including the liver, heart, and pancreas. That excess can contribute to oxidative stress, a process in which unstable molecules damage cells over time. Research has explored links between excess iron accumulation and increased risk of certain chronic conditions, including cardiovascular disease and cognitive decline. The symptoms of iron overload, fatigue, joint aches, memory issues, and heart irregularities are vague enough that many people attribute them to aging rather than looking at iron levels. Before continuing any supplement that contains iron, it is worth asking your doctor about a ferritin test or transferrin saturation test to understand whether your current levels are actually low. Many seniors who switch to iron-free multivitamins, specifically designed for older adults, find their other symptoms do not change at all, which tells you the iron was never needed in the first place. The third area of concern is calcium supplements taken in isolation. For years, seniors have been told that calcium is essential for bones, and that is true. But the way calcium supplementation has been promoted has often overlooked a critical piece of biology. When you are younger, hormonal systems help guide calcium efficiently into bone tissue. After 60, that guidance becomes less reliable. Calcium that enters the bloodstream through supplementation may not be directed to bones as effectively. Instead, some of it can end up deposited in arteries, joints, and soft tissues, contributing to stiffness, calcification, and increased cardiovascular risk. Multiple large studies have raised questions about high-dose calcium supplementation and heart disease risk in older adults, particularly when calcium is taken without the nutrients that help direct it properly. Those directing nutrients are vitamin D3, which helps the gut absorb calcium into the bloodstream, vitamin K2, which helps direct calcium toward bone and away from arterial walls, and magnesium, which helps balance calcium's effects in the body. Without these partners, a plain calcium supplement may not be doing what you hope. Food sources of calcium, including leafy greens, sardines with bones, yogurt, almonds, and chia seeds, tend to come with other nutrients and cofactors that support better absorption and utilization. If calcium supplementation is genuinely needed, combining it with D3 and K2 is a much more rational approach than taking calcium alone. The fourth area of concern is high-dose vitamin B6. B6 is a water-soluble B vitamin, which makes many people assume it is automatically safe to take in larger amounts, since excess will simply be excreted. But B6 behaves somewhat differently from other B vitamins at higher doses. It can accumulate in nerve tissue over time, and when that accumulation exceeds what the body can manage, particularly in older adults whose liver clears things more slowly, it can become neurotoxic. The symptoms of B6 toxicity, tingling in the hands and feet, numbness, burning sensations, poor balance, and muscle weakness, are nearly identical to the symptoms of peripheral neuropathy from other causes, including diabetes and normal aging. That overlap makes it easy to miss. The official upper limit for B6 is typically listed around 100 milligrams per day, but some research suggests that sustained intake, even at lower doses over long periods, can cause problems in older adults. Many energy support formulas, nerve health supplements, and senior marketed products contain B6 at levels far above what anyone over 60 actually needs. The actual daily requirement for older adults is modest, roughly 1.5 milligrams for women and 1.7 milligrams for men. That is easily obtained through food sources like chickpeas, tuna, turkey, bananas, and fortified cereals. If your supplement contains B6 in amounts of 50 milligrams or more, it is worth reconsidering. Now let us turn to the 4 nutrients that research consistently supports for older adults. The first is magnesium. Magnesium is involved in more than 300 biochemical processes in the body. It supports heart rhythm stability, muscle function, nerve signaling, blood sugar regulation, sleep quality, and bone health. And yet, it is one of the most commonly deficient nutrients in adults over 60. There are a few reasons for this. The digestive system absorbs magnesium less efficiently with age, and several medications commonly prescribed to older adults, including certain blood pressure drugs, acid-reducing medications, and diuretics, can deplete magnesium further over time. Low magnesium can contribute to muscle cramps, sleep difficulty, fatigue, heart rhythm irregularities, anxiety, and elevated inflammatory markers. Many of these are symptoms that seniors often accept as a normal part of aging, without recognizing that a nutritional gap might be a contributing factor. Research has linked in deficiency in older adults to increased risk of atrial fibrillation, metabolic issues, cognitive decline, and chronic inflammation. When it comes to supplementation, form matters significantly. Magnesium oxide is inexpensive but poorly absorbed and often causes digestive discomfort. Better absorbed forms for most people include magnesium glycinate, magnesium citrate, and magnesium malate. These tend to be gentler on the digestive system and more bioavailable. Food sources rich in magnesium include leafy greens like spinach and kale, pumpkin seeds, almonds, avocados, black beans, and dark chocolate in modest amounts. Because soil depletion has reduced the magnesium content of many foods over decades, supplementation may be necessary even with a reasonably good diet. The second important nutrient for older adults is vitamin D3. By the time someone reaches their mid-60s, the skin's ability to produce vitamin D from sunlight exposure has declined substantially, often by more than half. Add in reduced time outdoors, sunscreen use, and lower geographic sunlight intensity for those in northern regions, and deficiency becomes very common in the older population. Vitamin D3 is not just a bone nutrient. It functions more like a hormone that influences multiple body systems. It works alongside calcium and vitamin K2 for bone density. It supports muscle strength and reduces fall risk. It plays a role in immune function and inflammation regulation. It influences mood and cognitive function, and it has been associated in research with lower risk of multiple chronic conditions. Research involving large populations of older adults has found that those with lower vitamin D levels face meaningfully higher risks of respiratory infections, bone fractures, mood disorders, and overall mortality. Most standard multivitamins contain 400 to 800 international units of vitamin D, which is typically not sufficient to maintain healthy blood levels in older adults. Many clinicians and guidelines for aging adults suggest that 1,000 to 2,000 international units daily is closer to what is needed, with the optimal amount determined by blood testing. The preferred form is D3, also called cholecalciferol, which is more potent and bioavailable than D2. Since vitamin D is fat-soluble, taking it with a meal that contains some healthy fat improves absorption noticeably. The third nutrient is vitamin B12. Research consistently shows that a substantial proportion of adults over 65 have low or borderline B12 levels, yet most are unaware because the deficiency develops gradually, and the symptoms are easy to misattribute. The reason this is so common in older adults comes down to stomach acid. The body relies on stomach acid and a protein called intrinsic factor to separate B12 from food and absorb it efficiently. Both stomach acid production and intrinsic factor decline with age. Certain medications used commonly by older adults, including proton pump inhibitors and metformin, further impair B12 absorption. Even a person eating eggs, fish, poultry, and dairy regularly may not be absorbing sufficient B12 if the underlying absorption mechanism has declined. B12 is essential for the health of nerve cells, the production of red blood cells, DNA synthesis, and the maintenance of myelin, the protective sheath around nerve fibers. Low B12 can produce symptoms that strongly resemble other conditions, including peripheral neuropathy, anemia, depression, cognitive decline, and balance problems. It is one of the more treatable and reversible causes of these symptoms when caught. For supplementation, sublingual forms, lozenges, or drops dissolved under the tongue bypass the digestive absorption problem and deliver B12 directly into the bloodstream. The forms methylcobalamin and cyanocobalamin are both effective. Because B12 is water-soluble, toxicity is not a significant concern, and larger supplemental doses are typically well tolerated. The fourth and final nutrient is omega-3 fatty acids, specifically EPA and DHA. Omega-3 fatty acids are structural components of cell membranes throughout the body, particularly in the brain, heart, and retina. EPA and DHA, found primarily in fatty fish and marine sources, are the forms that research has most consistently associated with meaningful health benefits. The evidence base for omega-3s in older adults is broad. In the cardiovascular system, they help maintain flexible blood vessels, support healthy triglyceride levels, and reduce certain arrhythmia risks. In the brain, DHA is literally a building block of brain tissue and has been associated with better memory, focus, and protection against cognitive decline. In joints and muscles, omega-3s help modulate inflammation, reducing stiffness and discomfort. And at the cellular level, they are associated with protection of telomeres, the structures at the ends of chromosomes that influence cellular aging. Large studies have associated higher omega-3 blood levels in older adults with substantially lower all-cause mortality, meaning fewer deaths from any cause including heart disease, stroke, and certain cancers. A 36% reduction in overall mortality risk is among the more striking findings associated with higher omega-3 status. Unfortunately, most older adults in the United States do not consume enough fatty fish, which is the primary food source of EPA and DHA. Salmon, sardines, mackerel, anchovies, and herring are among the richest sources. The general guidance for older adults is at least 2 to 3 servings of fatty fish per week. For those who cannot or do not eat enough fish, a high-quality fish oil supplement providing at least 1,000 milligrams of combined EPA and DHA daily is a reasonable option. Quality matters with fish oil. Look for products that are tested for heavy metals and contaminants, ideally in triglyceride form for better absorption. Algae-based omega-3 supplements are also available for those who prefer a plant-based option. Taking omega-3s with a meal that contains some fat improves absorption. To bring all of this together clearly, The four vitamins that deserve more scrutiny after 60 are retinol-form vitamin A, which may accumulate in the aging liver, iron supplements, which most older adults do not need, and which can cause harm if levels climb too high, calcium taken in isolation without cofactors like D3 and K2, and high-dose B6, which can damage peripheral nerves over time. The four nutrients that research most consistently supports for older adults are magnesium, which supports muscle function, sleep, heart rhythm, and hundreds of other processes, vitamin D3, which influences bone health, immune function, muscle strength, and mood, vitamin B12, which protects nerves, supports energy metabolism, and maintains cognitive function, and omega-3 fatty acids, which reduce inflammation, support the brain and heart, and are associated with longer, healthier living. The most important takeaway is this: aging does not mean more supplements automatically equals better health. After 60, the goal is precision, getting the right nutrients in the right forms at the right doses, and avoiding unnecessary accumulation of things the body can no longer clear as efficiently as it once did. Before making changes to your supplement routine, it is worth checking current levels through blood testing for vitamin D, vitamin B12, magnesium, ferritin, and omega-3 index where possible. That information removes the guesswork and allows any adjustments to be based on what your body actually needs rather than what the label says. Because the goal is not just living longer. The goal is remaining strong, clear-headed, and independent for as much of that life as possible. And that outcome depends far more on daily choices than on luck or genetics.